Thank you, Madam Chair, for allowing me to present AB 460. A special thank you for your committee and your committee staff for their diligent work on the bill. We will be setting all the committee amendments. Current law requires on-site supervision for radiologic and technologists who are administering contrast materials, which has created significant delays and barriers in access to care. This bill redefines the supervision requirement to include an immediately available physician who is available via audio and video, with the supervising physician also having real-time live access to the patient's medical records. Additionally, we've added a stipulation that the facility shall have personnel on site who are capable of responding to any adverse effects during contrast, and we are committed to ensuring that this is clear in the language. The change will ensure patients receive timely and high-quality diagnostic care and aligns with federal CMS standards and will help with the backlog of patients that has caused delays in patient care. Today, we have witness testimony from Ryan Spencer, representing the California Radiological Society, who could help speak to the need for the bill.
Thank you. Please go ahead.
Good afternoon, Madam Chair and members. Ryan Spencer on behalf of the California Radiological Society sponsors AB 460. AB 460 simply modernizes California supervision laws by allowing radiologists to provide real-time remote supervision via audio and video when technologists administer contrast for imaging. That's it. Same procedure, same safeguards, just modern tools. Here's a core issue. Current law requires radiologists to be physically on-site, but in many rural and community hospitals, having an on-site radiologist at all times simply isn't possible. This results in patients experiencing delays in cares, sometimes in urgent or emergency cases, not because of lack of equipment or trained technologists, but because of an outdated supervision rule. AB 460 fixes that. It aligns California law with federal CMS policy, which since 2020 has allowed virtual direct supervision through real-time communication. This policy has proven safe and effective and is currently in place through 2025. More than a dozen other states, including Texas, Florida, New Jersey, and Alabama, have already adopted similar approaches. These states recognize that radiologists can be readily available remotely, while properly trained technologists carry out their duties under strict protocols. And importantly, as the Assembly member mentioned, AB 460 maintains and strengthens patient safety. This bill was recently amended to require that qualified personnel be physically present on site during the contrast administration to monitor patients and respond immediately to any adverse reactions. This ensures that even if the radiologist is remote, there's always somebody on site ready to act. In short, AB 460 improves access without compromising safety, reduces unnecessary delays, relieves strain on the radiology workforce, and brings California in line with modern practice. With that, California Radiological Society respectfully asks for your aye vote. Thank you.
Thank you. Are there any other witnesses in support? Please come forward.
George Soares with the California Medical Association in support. Thank you.
Any primary witnesses in opposition? Or me too's in opposition? Seeing none, I'll bring it back to the committee for question or comment. Assemblymember Schiavo, moved by Flora, seconded by Sanchez.
Can you please explain to me, just so I have a better understanding of how this works remotely? Can the person who is remote, can they see what's happening, or are they on the phone? Like, how does that work? How can they monitor or engage with what's happening on the ground remotely?
Thank you for your question, Assemblymember Schiavo. There's a multiple way for telemedicine to utilize. It can be done where they can be seen via telephone, or where they have a network in which they can be seen via video as well. We have seen the utilization of telemedicine from areas as far as Catalina Island to reach patients in Palmdale, Lancaster, an area that you're familiar with. But with that, I'll give some of the additional details to my key witness.
Typically, the reason why a radiologist needs to be on site is to answer any questions. There's really no other reason why they need to be there. And so right now, the bill was recently amended to require that also be audio and video. So it would be a video component. And so effectively what this does is it removes the responsibility for the radiologist to have to be next door. And every time the RT has a question like, is contrast needed? What type of contrast? What type of precautions are needed? They don't have to say, hey, can you come in here and talk to me? Or basically even pick up the phone and call the radiologist who might be in the next room. They can just access them through video teleconference, through telehealth, and be able to answer that questions. If there is an adverse reaction, which I know is the concern of members of the committee, including the chair, there will be somebody on site physically to be able to respond to that adverse reaction.
And so if the remote radiologist can give feedback to tweak the process as it goes along, to like during the procedure.
The bill requires they have to be readily available at all times to be able to respond to any questions that the RT has.
And are there any limitations on where this radiologist could be? Could they be in India or China or Europe or anywhere?
They would still be a licensed physician in the state of California, but in terms of
okay.
that's required. That's what we're talking about here. We
Okay.
aren't talking about somebody based out of. You practice medicine in California, you're going to need to be licensed in California. But no, there aren't. That is the law. But there's nothing in the bill that says that the person has to be a certain radius from the clinic.
Okay, but licensed in California.
That's correct.
Okay. Okay, thank you.
Assemblymember Patel.
Appreciate you bringing this forward and making sure that our patients get the care they need when they need it. Being the mother of 3 athletes, we have need a radiologist several times, so I can see the need for this. My question is, when it's done via telehealth, is there a requirement or any sort of assurance that these will be secure lines, secure communication channels as it is health data? I do have concerns just around data security and privacy, and also people interrupting the calls or listening in, so to speak.
Thank you so much for your question. It is my understanding that lines are very secure. It's not a line in which it can be interrupted in a way that it can be listened upon. Also, I have my key witness expand upon that.
The answer is yes. I mean, the bill doesn't specifically specify that, but anytime that you're using a telehealth network, it has to be. That's been since we started using telehealth. That has been a standard bearer.
So just to clarify, so this isn't just going to be somebody's cell phone that they're using FaceTime
It's
with?
correct.
Thank you.
As long as it's secure.
Seeing no other comments from the committee, I think we have a motion and a second. Assemblymember Chen, you can close.
Thank you so much for your questions. I really appreciate that. I respectfully ask for your vote.
Thank you. Motion and second. Secretary, please call the roll.
The motion is due pass to appropriations. Bonta.
Aye.
Bonta, aye. Chen. Chen, aye. Addis. Addis, aye. Aguiar Curry.
Aye.
Aguiar Curry, aye. Arambula. Arambula, aye. Carrillo. Carrillo, aye. Flora. Flora, aye. Gonzalez. Gonzalez, aye. Krell. Krell, aye. Patel. Patel, aye. Rodriguez. Rodriguez, aye. Sanchez. Sanchez, aye. Schiavo. Schiavo, aye. Sharp Collins. Stephanie. Stephanie, aye.
That bill's out, Assemblymember.
Madam Chair, we save the best for last. At your pleasure.